how is it that we keep this thing illegal from adults to consume, and yet there's children and the elderly who without this wouldn't be able to function.
And I'm hopeful that, we can develop really good, useful therapeutics using this allosteric approach that avoid, some of those negative side effects that we associate with cannabis.
Like right after breakfast and right after dinner is what I tell patients, because we want your body's already being primed for absorption, including absorption of fats. And so essentially what we want is we want the cannabinoids to hitch a ride on the fat and then into the body.
It's Reefer Madness, the podcast with Trevor and Kirk.
Kirk, we're back.
Hey Trevor, how's it going?
Good. So it's actually looking like spring around here, but a couple weeks ago, I went to an ice fishing tournament.
Okay.
And I ice fish, I enjoy it, but I've never actually been to a derby, a tournament before. Our producer, Renee, as part of his actual job, goes to lots of these with, representing his radio station, CKDM here in Dauphin. So he goes to, I've lost track, I think it's between 3 and 6 every winter for a couple months, and, February, March, I think every weekend he is sitting on some ice somewhere, ice fishing as part of some tournament. So I went there sort of as Renee's guest. It was very cool. Just picture a huge checkerboard with lots of holes. One of the really good fishermen in the area, Don Stockatell, and he says it's really like a lottery because, you just have, every 3 feet another hole and a line dangling out of it. So, it's not really a skill thing about whether you got a fish or not. It's just where the fish happened to be. But anyway, it was fun, cold. It never really got above minus 15. So it was also very nice. We had the CKDM vehicle nearby to jump into every so often and warm up and have snacks. Renee brings great snacks, by the way. If you go somewhere with Renee, ask Renee to bring snacks. They are excellent. So we were out there all day fishing. Now, I was just happy to be out there. It was in Crane River. I've talked to people in Crane River. I haven't actually been there. So it was just kind of an adventure for me. But Renee has been on a bit of a losing streak. He goes to many of these tournaments and hasn't got a fish in, we won't say how many years, but it's been a little while. And so we weren't catching. And there's people nearby we saw catching. And then, the horn was going to go at, I believe it was 3 in the afternoon. And, it's 5 to 3. So we're getting our stuff ready and getting ready to pack up and go. And suddenly this little grandmother comes up. She's all excited. I don't know what she's excited about. Renee has caught a fish. And so we've dumped the water out of our buckets. The trick is you have to bring it in live. So you have to have a bucket full of water, harder than you'd think at minus 15. And we've just dumped the ice and whatnot out of our bucket. So now I have to try and fill Renee's bucket back up so he can waddle / not slip and die all the way across the thing to the measuring tent on time before the horn goes. We have literal minutes to spare. And Renee gets all the way over there, gets measured. It's all exciting. This is the best way to end the day ever. And then we have to come back and wait for prizes, and they go through a bazillion prizes. We didn't win any of those, although we bought a bunch of tickets. And then finally they're doing the money fish. So the way this tournament goes, the 10 longest fish get prize money. Like the number 1 longest fish was get $10,000. But we just, wanted Renee to be in there somewhere. And they started at the bottom of the list. The bottom of the list was 1/16 of an inch longer than Renee's. Renee was 1/16 of an inch away from $500. The 10th fish was getting $500. So it was a good and productive and exciting day and good snacks. And thank you to the people of Crane River. You put on a great tournament. Ochi-Chakasipi, I think I said that right. The Ochi-Chakasipi ice fishing derby. It was a great time, enjoyed ourselves, and Renee was just this close to $500.
All those years.
But he's on the board again. He's got a fish, nor I'd say a fish in the boat, but a fish in the bucket.
Well, it's like golfing, right? It only takes one hole to bring you back to another season of golf, right?
Yes.
Yeah. So, women's health.
Yeah, perfect segue.
We're talking to Dr. Genester Wilson-King from Florida. This was
lots of ice fishing there too.
Oh, sure. Yeah, well, yeah. Well, this has been an interesting relationship. We've interviewed Genester in the past. If you go to our back to our webpage, you'll see that we did a whole episode with her on endometriosis. And I can remember at the time saying I would like to talk to her about prenatal use in cannabis.
Yeah. So tell us a little bit about this. So, we won't get too far, but, she's an OB-GYN, so she knows about babies and deliveries and prenatal care. That's her thing. And I listened to it. We talked about it. I thought it was a really good conversation, but, well, I'll give my 2 cents. Cannabis in pregnancy is controversial, to say the least. And none of us healthcare professionals want to be seen as promoting cannabis in pregnancy. That's bad. We shouldn't. As we say several times during the interview, and you guys say, the best pregnancy has no alcohol, no drugs, no smoking. You eat well, you get your exercise, all that good stuff. In a perfect world, no cannabis in pregnancy.
Trevor, there's so much stigma with cannabis that even cannabis doctors have to be concerned with how they portray cannabis.
Well, yeah, and again, all healthcare professionals, all with licensing bodies, and rightfully so, we have to be careful what we say, how we say it, and sort of how it's perceived by the public. Those are all things our licensing bodies look at. So,
like I said, I truly enjoyed her company. I'd love to meet her face to face. She's a wellness doc. She's been an OB-GYN for 25, 30 years. We won't go there. She's been a cannabis doc 12 to 15 years, depending on when her interest was sparked. And I believe she was brought into it late in her career and realized, oh my goodness, right? So she's a wellness doc. She talks about clean air. She talks about, good diet, meditation. She balances her care plans as individualized. She's very quick to say that her practice is individualized. Now, I'm not saying all family doctors don't individualize their care, but there's a lot of algorithms that doctors have to follow nowadays, and that's for all sorts of medical, legal reasons. But as a cannabis doc, she is full aware that people do use cannabis during pregnancy, and that's where the discussion goes. We're not advocating cannabis in pregnancy. What we're talking about is we're talking about overall women's health, and if cannabis is a therapy for you during pregnancy, then let's listen to this episode. So do you want to say, let's just spark into the interview, because this is a two-parter, and we've already taken a fishing story up here. So let's get into her discussion. Yeah, that's all right. Let's get into the first part of the discussion. And at this part of the discussion, we're going to be learning about the endocannabinoid system. We're going to learn about how it is a big part of the reproductive system. And we're going to learn a little bit more about hormonal therapy and how she balances all that. So let's just go into the interview.
Absolutely.
All right, my friend. How are you? What's happening in Florida? Introduce yourself and what's happening in Florida right now.
Well, I am Genester Wilson-King, MD, FACOG, and I do put those letters there, but they're really simple. It means I'm a medical doctor, and I'm also board certified and whatever other blessings they want to put upon me from the American College of Obstetrics and Gynecologists. So I have been practicing in Florida for many moons and have just loved it for sure. I got into cannabis, started really looking at it in the early 2000s and then on from there. And as I told you before, the first two books, the first book I read was from Lester Grinspoon and called Marijuana, the Forbidden Medicine. And then the first literature article that I read was Melanie Dreyer's Cannabis Use in Pregnancy, Jamaica study. So I got a real quick taste of cannabis as a medicine and how some people use it in pregnancy. And lo and behold, did I find out that there is a history of cannabis use in women's health, period, in gynecology and obstetrics. So uh, this was, it was new to me, but it was nothing new to the world at hand. So what's going on in Florida? We have a robust medical program that uh, has upwards almost 1 million people on the program. Uh, the state has 23 plus million people in it, and then 44 plus million visitors. Well, we had 44 plus million visitors last year. So we get a lot of people around here, and uh, there's a lot of cannabis being sold for sure. So what I love to do is help guide people through their cannabis journey, and particularly women, but of course I take care of men as well. Um, and it's a pleasure to do it because I see so many wonderful things happening to people. So yeah, I'm loving it for sure.
Right.
Now I still do gynecology and I do hormone therapy, treat menopause and perimenopause for sure. So
Yeah, so unpack a lot of that. Grinspan,
right.
we had
It great it actually is a great complementary mode of therapy, hormones and cannabis, and it works really, really well.
yeah,
So
yeah, yeah. So Florida is a medical state for cannabis.
yes,
Is it a rec
yes.
state as well?
No,
No.
we had
Okay.
the vote last year, Amendment 3, and it failed. Florida has a 60% level to pass uh, in order for something to be passed and received as law.
Okay.
So we fell short of that 60% threshold. Now, many things do. When we were voting for medical cannabis, the initial vote was 2014, and we got to 57.6%. I may be off by a few, but 57.6%. And the next time, 2 years later, 2016, we passed with flying colors. We were 60 plus percent easily. So the 60% threshold is a huge threshold, but it also is something in which it can't pass silly stuff. Well, at least that's what it's supposed to prevent. So that's why the 60%. So,
So your practice, obviously you specialize in women's care as an OB-GYN. You're still certified with the board. Your
yep.
practice is also cannabis. So
Yes.
so what is so have you how have you blended those two specialties?
Oh, it's really easy to do so. Um, if I have okay, for example, if I'm managing a perimenopause or menopause patient, and I do it with my routine modalities, which 90% of the time are quite effective, but there are some people that have baseline problems. Say, for example, let's take anxiety, for example. Now, anxiety is significantly worsened in the perimenopause and early postmenopausal stages, certainly throughout perimenopause. And we have some easy remedies for it. Usually, their progesterone and estrogen are imbalanced, and then you need to just add progesterone. Um, that generally works. And then a few other things that we do generally work too. But sometimes it doesn't quite do the trick. And that's when I'll pull out my cannabis equipment and address the patient with some options for use for that. And it generally goes over really well because by the time people are coming in to see me about their symptoms are pretty present more often than not, probably. So
Okay.
it marries very well. And I do have a saying that I use, and that is uh, postmenopausal or perimenopausal female who is hormonally balanced and uses cannabis is a brand new woman You have a new lease on life. You feel really good. You can sleep, you can laugh, you can have fun, you can be active. All those things help you. Now, I don't just do hormones and cannabis. Certainly, I address the lifestyle behaviors. What are we eating? What are we doing with our body? And what kind of downtime do we take? Do we meditate? Do we do yoga? Do we do Tai Chi? Do we do all those things? And of course, all of those things together really help the person to become a whole person, really, or at least the person they want to be.
Well, your website is about wellness. I mean, I see you as not a sickness doctor, but a wellness doctor.
Right.
So, and obviously
Right.
with your board certification, OB-GYN, are you still you're not full-time into labor delivery anymore?
That is correct.
Yeah. So, but are you
Right.
still you're involved with some prenatal and postnatal consults?
Certainly, yes, but more on the along the lines of, may I use cannabis? What are the pros and cons of that? How do I do it? Things like that.
So
That's
in
that's
pregnancy, I mean, I've heard you speak. We've talked before, and I guess one of the concepts that I've had is that you've got an individual that has a seizure disorder, and they use cannabis for that. Would they be recommended not to use cannabis during pregnancy, or how would that blend into wholeness and wellness care of an individual?
sure. That's a great question, Kirk. Um, the the way I approach it is, okay, first we look at, is there an alternative? Is there an alternative that doesn't involve cannabis and is also safe and is also effective for the patient? Because the reason the patient is probably on CBD is because they failed pharmaceuticals. At least that's the way it usually goes. Um, so we answer those questions. Is this the only medication that worked for you? If it is, then no, you cannot really stop it because you don't want allow a patient to just freely have seizures. That is not safe, and that can be quite harmful. So, and we can try and decrease the dose, but if they've taken a lot of time and effort to get to the dose that works for them, I don't think I would mess with the dose. I would leave the dose the same. And, as far as CBD and pregnancy goes, oh boy, there's a lot, up until, let's see, up 2020 is when the Society of Cannabis Clinicians, of which I'm vice president of, or I should say, of which I'm on the board, released some modules. And two of those modules were cannabis use in pregnancy, and the other one was cannabis use in women's health. There were 23 modules. They're all very excellent. And we looked at there were only 3 studies that I could find on CBD. Well, within the past 3 years, there are up to 10, which is really, really pretty amazing. Now, the earlier CBD studies showed that a single dose of CBD was short-lived in both mother and fetus and unlikely to accumulate over time. However, we have another study, and these are all preclinical studies, all animal studies. CBD could interfere with the placenta and some important placental mechanisms, such as there are 2 substances that are significant for drug transport throughout the various organs, including the placenta. And CBD can interfere with that during, if ingested during pregnancy. So it's an animal study, doesn't always, animal studies don't always translate to the human experience, but it's something we need to pay attention to. One of the reasons we really need to pay attention to it is that there was a study that was done in the US and Canada in which they polled patients about their use of cannabis, and they found that the use of CBD only during pregnancy was quite high. And the reasons varied between anxiety, of which 58.4% of pregnant women use CBD only, pain, and depression were the top two. The other three, headaches, PTSD, and nausea and vomiting. Interesting that nausea and vomiting is about sixth on the list. It wasn't at the top, which you would think it would be, because that would be a reason to use cannabis during pregnancy. But these other symptoms are uh, good reasons to use cannabis during pregnancy as well. And this study was specifically CBD. So we see more and more and more women are using this during pregnancy. So we've got to find out what's going on. And so getting back to the patient who's using CBD, these are some of the things I would share with her, that it isn't the totally benign product that we thought it was. There are some issues, and with the increase in use, we could start to see some problems. So I primarily try to help people use the lowest dose possible and for the shortest amount of time. Maybe uh, we'll look back and really take a really good history about what they've been doing and things like that. But generally speaking, you get down to letting their dosing remain the same because you don't want them to have seizures. And you have to, and in this instance, you really don't have a choice. If none of the pharmaceuticals work and the CBD worked, high dose CBD, then I don't think you have any choice but to allow the patient to continue using it. Um,
In that scenario, do you have a preferred method of route of ingestion? I was going to say injection, that's not right. But do you have a preferred route?
I would use oral, preferred oral, mainly because oral does have okay, this is individualized with the patient. This is not what I would do for everyone. If this patient can't use anything else, then yes, they're going to stay on CBD. And however they were using it is how we'll continue to use it, because you don't want to disrupt the stability of the suppression of the seizures. You don't want to allow seizures to start to happen. So I wouldn't change her dose at all. Others in which there are conditions that are not so dire and so need of the medication, we could maybe adjust it a little bit, use the lowest effective dose, use oral as opposed to inhalation. Actually, sometimes down here it's a little more difficult to find CBD that you can inhale. So not a lot of the dispensaries find that that is something that they highly sell. Unfortunately, when you get into retail and whatnot, you're going to sometimes fall to well, this doesn't sell very much, so we're not going to make very much. And then it gets harder to find something that you really need. So,
Okay. In Florida, it's medicinal. So the process is an individual would go see their family doctor and be referred to you. Is that how it works?
or they can come directly to me.
Okay.
Yeah.
And if that and then I mean, I will direct people to your webpage from our webpage. You're like I said earlier, you're definitely a wellness doc. We are a podcast about cannabis, so I'm going to draw more comment and
Absolutely.
editorial. So now the female anatomy. Can you explain how that is special to cannabis or endocannabinoid system? Is something, are women more prone to using cannabis than men? Is there anything about their anatomy, physiology?
Well, both reproductive tracts, the male and the female, have all the components of the endocannabinoid system in them. So I'll address the female. There's components of the entire endocannabinoid system found in the ovary, the uterus, the fallopian tubes, the cervix, the endometrium, which is the innermost part of the uterus, and the myometrium, which is the muscular wall of the uterus. And the endocannabinoid system parts are found in female reproductive fluids as well. We've also found CB1, CB2, Fa, and NAPE PLD in human follicles, excuse me. And there are more CB2 receptors than CB1 in the pelvis. So it's all over the pelvis, and it's also very involved in gynecological problems as well as in pregnancy. The endocannabinoid system plays a really good role in pregnancy. I mean, it plays several roles throughout pregnancy. In the very beginning, it helps guide the embryo through the fallopian tube and to the uterus for implantation. And the the endocannabinoids play a little dance in that the area closest or exactly where the implantation is going to take place has a lower level of anandamide, and the area outside of that has a higher level, and those have to play their roles in order for implantation to take place. Also, during fetal life, the endocannabinoids and receptors, CB1 receptors in particular, are important for brain development, regulating your neural cells and creating them, and also the area in which it's like the axons and the synapses. It's the endocannabinoid system is involved in synaptogenesis. And anandamide protects the developing brain. So you see the endocannabinoid system throughout the GYN tract, throughout implantation, throughout fetal life, and then it's involved after birth with the ability to suckle, which was found by a research scientist who worked with Dr. Meshulam. So this is the endocannabinoid system is very, very important, and it is throughout the female and male reproductive tracts. And
I
it's
got to tell you,
highly intimately involved in pregnancy and other conditions. Yes,
I
I'm
got to
sorry.
tell you no, I got to tell you that's fascinating. I have never heard it explained quite that way. What sparked in my head is a question I've been wanting to ask practitioners, and I never quite get the question out. So here's a new question for you that I've been meaning to ask practitioners but never have. Is it difficult to draw blood and get people's endocannabinoid levels? I mean, it's nothing to get their CBCs, electrolytes, draw routine blood. How difficult is it to get people's endocannabinoid levels?
Well, as with anything in medicine, if it's not necessarily proven yet, and they haven't found, yes, there is use for it, but it's still considered somewhat experimental for the masses to get involved in. Certain people can go to the lab, and I believe no, it can't be in Texas. I don't know where it is, but there is a lab that will do it, but it isn't really open to the public. So it's very difficult to actually get someone's endocannabinoid system mapped out.
Which fascinates me because the more I learn about the endocannabinoid system, and like tonight, this afternoon, is you would think that getting a routine levels check would be important because it's like getting your vitamin B checked. The endocannabinoid system is involved with our homeostasis, and I mean there are some theories where people that don't feel pain have an enhanced endocannabinoid system. So I would think. So let me reframe the question. Yeah, it's difficult as a practitioner. Do you ever foresee it becoming a routine check?
Oh yeah, I know somebody's working on it now. I'm sure. I truly believe it will become available. We'll have to see how it really is going to help. Is the test going to be good enough so it can really give us a nice map of this person's unique endocannabinoid system, and then that we can extrapolate that to help us determine products, what products are good for you, what products should contain that are not good for you. So I think that it's coming sooner, probably rather than later.
Okay, that was a very spontaneous question. Getting back to your practice, and let's get back to the studies. What are the studies saying about cannabis? And I guess part of the thesis of this episode was to talk about prenatal care. So is there, you spoke earlier, sorry, I'm trying to formulate the question. Here's the question. I'll edit all that out. Here's the question. What is the worst thing that can happen in the case of care of your individual and somebody that is recommended that cannabis would work for them? What's the worst thing? What's the worst risk? I mean, risk management using cannabis, right? In the care of a prenatal person, if there's risk management there, can you get into that?
Well, yes, there is a reason for all this cannabis based fear of use in pregnancy. As I just illustrated to you about the widespread presence of the endocannabinoid system in the pelvis and involved in throughout pregnancy and whatnot, there is concern that introducing more, or what we call exogenous, meaning from the outside, cannabis phytocannabinoids can cause a problem. You can understand the reason for concern because it can easily interfere with the endocannabinoid system. Now, the problems with some of the studies in looking at cannabis use in pregnancy is they're saying the adverse outcomes are low birth weight, preterm babies, and NICU admissions, it's a kind of a pet name for neonatal intensive care unit admissions. And these are all, they can occur, but they're not widespread, and they're really of low certainty. The National Academy of Science, Engineering, and Medicine put out a report in 2017 that really looked at cannabis. They looked at over 10,000 studies. And what they found in relation to the low birth weight was that the smoking of the cannabis was probably more contributory to the low birth weight rather than the cannabinoids themselves. So it's what smoking, nicotine does to pregnancy, to babies in pregnancy. They lower the birth weight. And so smoking of cannabis does a very similar thing. The NICU admissions, there really haven't been any good studies that really looked at that. So that's kind of a low certainty result as well. But the neurodevelopmental effects are seen, and it's just amazing how the one study can find all this association with cannabis and autism, cannabis and ADD, cannabis and behavior disorders, etc. But then you can have 5 more studies that don't have any findings of that. So we're all over the place. The word is inconclusive. A recent study from Kaiser Permanente in Northern California, one of the largest insurances in the country, really. There are Kaiser Permanentes all over. But they did a urine drug test in the first between 8 and 10 weeks of pregnancy on all their patients, and then followed them and followed them through pregnancy, the kids are, I think, anywhere from 8, 9, 10 now, and didn't find very little significant difference or increase in all those conditions: ADD, ADHD, autism, behavioral disorders. etc., and school performance. So you can have one on the one hand, findings that are oh my gosh, and then on the other hand, you'll find that there didn't seem to be a problem. The problem is in doing this, number one, it's very difficult to isolate pregnancy to one substance. We have to breathe air. We have to drink water. We have to eat food. We have to not just drink water, but drink drinks as well. So everything is not pure and sterile. Everything, even breathing in air pollution, can cause problems during pregnancy. Stress alone, without any other substance, can cause problems with adverse outcomes in the baby. And I should stop saying problems. What I mean to say is adverse outcomes with the babies.
And
so
that's exactly the thing that I was thinking about as you were talking about those studies, is that when I've read these studies and they equate cannabis as being harmful, you start reading the other I don't want to say morbidities, but the smoking cigarettes, maybe the occasional drink, they live in an urban environment, they don't walk, they eat, their diets are poor. It's very difficult to just isolate any studies that are on just cannabis. Melody Dreyer, you dropped her name earlier in this interview. I remember reading one of her studies in the 90s. She was able to have a cohort that was pretty. Could you speak to that a little bit and what might be happening with that study?
It was the first prospective study in pregnant women using cannabis. So it was a very small study, 20 patients in the 20 participating who are using cannabis, and about 23 or so non-cannabis using moms, and compared the babies to them. They followed these women throughout their pregnancy and until the child was age 5. And they found no difference in the children's neural development and the children's school performance and etc. In fact, some of the cannabis exposed babies had higher or better Brazelton scores than the non-cannabis using babies. But again, we have to look at the situation. Number one, we're always talking about association, not cause and effect. Number two, we do not know a mechanism through which this can happen. Number three, the environment in which the participants, controls or experiment group, were living was a different environment, say, in the US, in that they lived on an island in Jamaica. They grew a lot of their own food. This group of people, I respectfully point out, the Rastafarians didn't really believe in alcohol use or cigarette smoking at the time. Primarily the men smoked cannabis. The women primarily drank cannabis tea. There's a difference in the method of ingestion of the cannabis. Is that the difference? One is using oral, the other is smoking. So there's all sorts of factors that factor into this study as well. It's not as simple as we try to make it be. It's very complicated. And there are so many comorbidities, and that is an appropriate way to call them. If they were using other things that were harmful, I'm sure that factors in as well. But I believe that the researchers on this study, there weren't a lot of comorbidities. They did find the kids that did better in school, though, were the kids that were a bit more socioeconomically advantaged. And they had more attention from the adults in the home. And sometimes the difference is just how you how you manage your children. Do you emphasize education and things like that? That may be the difference, not the cannabis. So we have to look at other things.
Yeah, it always seems to get to the social determinants of health, eh? If we could only fund the social determinants of health, would we not have if people just would fund the social determinants of health,
it's not just people.
Yeah,
it's government.
Government.
I'm sorry, I interrupt. It's
no,
government.
But people elect government, right? People elect government, and I use
they
people
do
because we're responsible for the government we have, right? Unfortunately,
don't remind me.
So is our educational system. However, so
that was great. And I know you made me promise to keep this brief so we can get people over to part 2. But some of the things that's kind of blew my mind from this half was, I don't know why it surprised me, but thinking about the whole, well, both male and female, but we're focusing on female reproductive tract just being chock-a-block full of the endocannabinoid system, and the one that truly made me go, wow, was anandamide having a role in implantation of a fertilized embryo. Going, well, that just never occurred to me. That was way out left field. That was in another province left field.
Yeah. I completely agree. That blew my mind when she started going into the endocannabinoid system and the whole reproductive system and how. And this is why I asked the question, and I've been trying to ask this question for quite a while, is that if the endocannabinoid system is involved with so much of our well-being, why can't we draw blood for it? So,
well, you guys talked about it, and I think she answered that well. A, there's just not a standard test, but I think B, right now, my impression, Trevor's impression, so I could be way off base, is so if you find out that your anandamide level is X, well, what does that mean? I don't think there's any good answer to is that too high? Is that too low? Should you supplement it? Like, you can find out what it is, but what are you going to do with that information?
Well, I guess you need a starting point, But you know what? Yeah. Let's coax people into part 2, because we get into, in part 2, we start getting into route of administration. We start talking about routes of administration. I just said that. But also we start getting into nausea, vomiting. And again, I want to stress that the best women's health, prenatal health, no drugs of any kind. However, in the next episode, she makes a bold statement. So come back to part.
You won't miss it. You won't miss the bold statement. Our jaws are still on the floor.
Very much so. Come back to part 2.
Check out the complete library of Reefer Madness episodes at reefermed.ca. And make sure to follow us on all the socials for bonus info on what Trevor and Kirk are up to.
Where does cannabis... Sorry, go ahead.
Can you hear that lawnmower?
No.
Okay, good. All right.
No.
No. Because I was going to go out and say something.